I think one of the most deeply disturbing parts of mental health has to do with the amount of times I've heard the word brain and other important parts of decision making and problem solving and thinking and thought. And how frequently there's a discussion about an emotion, a feeling, a language describing a described sensation in a body. And the brain, when you push on the brain with a sharp object in neurosurgery, causing no suffering other than the process of removing a tumor or another procedure requiring a patient to be awake during a surgery. In other words, the brain could get beat with a bat and there'd be no pain. But when a counselor, social worker, a psychologist, a psychiatrist, a staff, a nurse, a doctor ask about how a person's feeling with their self and trying to manage an ego and fix a mind, there's no longer a brain and a body. There's a person who's taking control to solve a problem they fix with information provided by a patient who doesn't know about an amygdala, slow thinking and fast thought, who mostly smoke cigarettes and do drugs to have a mindless consciousness, leaving their brains, their selves, their ego, their mind outside of their home so that inside of their room they rent. They're not bothered by unnecessary thinking and thought, requiring decisions simplified and reduced. Not once, other than an MRI, CAT scan, CT scan appointment, have I ever heard the word brain talked about in a conversation about mental health. Mental has gotten so intelligent and brilliant and genius. There's now systems within systems and processes involving other processes within other systems in an overall system called psychology and psychiatry. Using colors and stimulation to describe a world, also known as consciousness, information received from world visually and auditorily, and providing rewards for making those emotions more positive and uplifting, cheerful and social, rather than depressed and lonely. It's almost as if colleges and universities have decided cartoons are the best description for consciousness. Animation, graffiti, colors, bright, lucid, vivid imagery, cultural music and sounds with rap and electronic technology included now. And what they're saying has to do with the benefits they're describing with confusion and misdirection and similar effects as psilocybin or some hallucination drug. And these distractions, these confusions, these misdirections, and these induced hallucinations are a reward. For some, completely annoying, and for others, a source for excitement, staying up all night and smoking crack all day, getting high and puffing on a cigarette and drinking booze. Mental health. Two words. But no explanation for where those thoughts and those thinking, those feelings and those emotions come from in a body and brain, in a world, on an object floating in outer space.